Thank you very much. And now we have Clara Cavero. Hello. First of all, I'd like to thank the Association, the Foundation, and Carmen Espinoz for organizing this symposium. We're very lucky to meet every year here. Most of you know me by previous meetings. Otherwise, you know Lucia Paramon. Probably you've cooperated with them with some qualitative research project. I work in rare disease research department at the FISABIO Foundation, managing most of the biomedical research in the Valencia region. And I'm the rare here. I'm not going to talk about treatment, chemistry or whatever. I'm just going to talk about epidemiology, about some resources that we have in Spain, and especially in the Valencia region, which is where the scope of action for us. When we talk about epidemiology, we are referring to the science that studies the distribution and determinants of events related to health in a specific population, and their results are used to the control of health problems. So the aims of epidemiology and epidemiological research for rare diseases are to increase knowledge of the distribution and real situation of rare diseases and their consequences in the population, to apply epidemiological methodology in studies to identify determinants of rare diseases, to study the quality of life and the health needs of those involved and their families, and develop registers and databases as key elements for research in the field of rare diseases, epidemiologic, genetic, and clinical, and so forth. So, given the lack of knowledge about rare diseases, the strategy at a national level, and especially in the Valencia region, was to develop information systems and creation of national and international research networks based on research for health policy implementation, prevention and control, and ensuring equity in patient care. So, what is a register, a data file or archive? We have all these more advanced softwares, but just to try and explain the concept, it has all the cases of a particular disease or other relevant health conditions in a defined population, and it can have some monitoring or not of those patients. And we think of a registry of disease or patients, we need some homogeneous, very similar characteristics information, but with rare disease registers, there's high complexity for variety of clinical manifestations and so forth. So we have four main issues here. How many rare diseases we have, sources of data, visibility issues by the codification we use, and finally the prevalence by less than 5 per 10,000. So we might have small numbers, and that hurdle jeopardizes the statistical analysis.
First of all, we're going to go for official information on official websites. We're going to see high variability that we have when it comes to rare list, not because of mistakes, but because there's lack of knowledge and we need to study them more in depth. Some of them are cataloged as a rare disease, but after studying them in detail, we see a subtype of an existing disease or something on the other side. That's why it's a number that changes throughout time and is flexible. The second issue we have here, I'm giving you an example for the study that we did in Wilson disease. I will be sharing with you data. We have 14 autonomous communities in Spain. We see the multiple data sources. You know that in our country, in Spain, there's a decentralization of health services under the Ministry of Health, MOH. Okay, accessibility and availability and quality of those sources are going to be different among each autonomous community, and they decide or give you the what they want as better. If this happens in Spain, imagine other granular administrative systems in other countries. We have here the codification or the IDEC that assigns a specific code for disease and its subtypes, the CIE that we have, or ICD. This is what we have here, and non-specific codes. In the 9th revision, Wilson was included in non-specific codes, so disorders of copper metabolism. The same happens in the 10th revision or 10th versions, CIE in Spanish, and it has a specific code on Wilson disease, which is E83.01 in the ICD 10 in English. That will be the English version. And the fourth issue that we have is we do not have all the statistics report that need to have the reliability, but you have to have at least 20 individuals in the population. So the measurement viability increases, accuracy decreases. The rates have to be based on plus 20 cases, so we need to work with ultra-rare diseases. But why do we have these issues? Why do we need these databases? Why do we need these registries? The two main characteristics: we need to be exhaustive or have completeness, and we also have to have a standardization. We need to follow the same methodology based on the necessities that we have in each autonomous community. And if we talk specifically about Valencia, even in our health departments, if we talk about the epidemiology for the Valencian, for the Generalitat Valenciana, first, the rare diseases research areas represented by yours truly, and then the Subdirectorate General for Epidemiology and Health Surveillance. We work together. We work with the epidemiology, and both institutions are part of the Alliance of the Translational Research in Rare Diseases in the Valencian region, which is called AITER in Spanish. That's AITER. Right here in the 2012, because of the Directorate of Health, we now have a list of that. The objective of the system is to provide validated epidemiological information for rare diseases that are monitored in the Valencian community. And it's very important when we talk about registries that we have patient registries that are used usually for clinic or advocacy groups, and medical or a state register. And it's also important to understand the definition of a case. We are following the state registry, so we have rare diseases that have been diagnosed in a person independent of age and gender that reside officially in the Valencian region. And this has to be compared to the registry that started in January 1st, 2010. And what is excluded? We do not exclude rare tumors, obligatory or compulsory declaration diseases, congenital anomalies, or, for example, this is very important because all those that have the mutation but do not have asymptomatic manifestations will not be included in the state, in the regional, but that will not go to the state registry. The sources of information that we use are the registries of mortality, metabolic disorders, renal patients, congenital anomalies, and we do a random and active search, Boolean search. We have a minimum basic data as per ICD 10. We obtain possible cases that are enter into the software. We review them. Those potential cases have to be reviewed and then validated. Some of them, because we don't have enough information, and because the diagnostic processes is not easy, it could be a non-diagnostic or suspect of another disease. And therefore, not all the cases that we have are possible. Of those confirmed cases, we do have rare diseases that are sent to the state registry and some others that are sent to the autonomous region registry. And we have the data here that help us to have better health policies and better allocation of monies, distributions by gender, age, life status, the follow-up, and also this goes to the hospital system that they're attached to or that they have admitted to. From the software point of view, this is the results that we have regarding the Valencian region rare diseases. I asked them to send me the most updated data. We have over 7,000 rare diseases cases. This data has not been yet published in the state, in the national registry, but this is from the autonomous community, 124 cases with Wilson diseases, more men than women, higher prevalence in Valencia and Alicante province if compared to Castellón, and an ascending trend, probably because we're lucky, less lethal disease, and the quality of sources of information that we have here in Valencian region. We see the age is going to be different, men vis-a-vis women. Very good to see the death mean age very, very low. We are very lucky with that. And this is for the Valencian community. But if we look at the national registry, this was financed by Fundación por Amor al Arte that hosts us here. And we gather epidemiological information with the participation of 14 autonomous communities and also the Institute for Research on Rare Diseases of Carlos III. Because we did not yet have the ICD-10, we were, of the cases that we identify, some of the cases we were only able to confirm 514. It's not that they were poorly coded, but they had other copper metabolism disorder, and then case or non-case, because some of them were being diagnosed, or because we didn't have enough clinical documentation. This case actually helped us, that now are from another group of 10 in the national registry. You can see them listed there. Okay, Marfan syndrome, Huntington cystic, hemophilia A, tuberous sclerosis, phenylketonuria, Goodpasture syndrome, renal dysplasia, Wilson disease, and amyotrophic lateral sclerosis. Those are what we have. Right here, we have the technical chart that we use, and this is based in what we have in Orphanet, and the ID. Here we have all the potential codes from the ICD and the sources of information that are available, and also the specific or non-specific potential treatment. And here we have validation criteria that are established, and that is the declaration from healthcare professionals and also genetic sources and the combination of orphan treatment and also confirmed cases, so we don't even need to go into the clinical documentation. All the rest of the cases have to be confirmed. This is the last data from the National Registry in November 2022. Cases reported up to December 31st, 2019. 6 communities did not send information. We have 54 deceased, 814, and always more men than women. Regarding prevalence, you can see it here. It has been granulated by autonomous communities. Here you can see the 28 rare diseases that will now be part of the National Registry. You saw the first 10 in the previous slide. Now you have the full description right here. 28 turret and infantile tumors are also monitored. With all this, like I said, both epidemiological research on epidemiology into rare diseases and congenital anomalies enables us in the Valencian community to be carried out, to identify risk factors, to propose prevention measures and health policies, and to improve social and healthcare and quality of life. For that, we need the collaboration of healthcare professionals, researchers, and patients associations and advocacy groups. And just to finish, I would like to thank you for your attention. And of course, our main objective is we need the help from everyone to work jointly. And again, thank you so very much. And this is my email in case you need anything.